a system, for instance, if you have a mother that lives in Miami Beach, and it will inform you whether or not her systems are out of whack, or whether she's taking her medication, because within that system of her patient-centered care, she has friends. Just like a Facebook, she has friends that will be informed and when anything's out of whack. And so most people in their 80s and 90s are not computer savvy. So they have information on a cell phone. It'll ring the cell phone, say, did you take your medicine? And if they don't respond, it'll beep you. And so there, it's kind of a...
like those call buttons.
Yeah, it'll call back. So there are ways for those who are, not computer savvy. For the indigent, that say, I can't afford a computer, I'm trying to put food on the table. Well, guess what? We're going to have to do something about that. And, we are great utilizing food stamps. We're great in providing Medicaid. I think we can provide the technology. That's our responsibility. We want to change healthcare. We've got to make some dramatic changes in how we look at things. And just because somebody's poor, somebody doesn't have a good job, doesn't mean they can't have access to technology and healthcare the way you and I do. And we just have to change our attitude about it. It's that simple.
You think it will change?
I think we will. I think we will. Look, no one wants to pay something for somebody else that they don't get a part of. That's just human nature. But let's face it, that's got to stop. I'm going to pay more taxes. You're going to pay more taxes, and we're going to struggle with that. We're going to argue with that. But ultimately, I don't settle in because I think that'll drive us to having to design our system back to the points that I talked about: the new delivery system and technology. And I just believe in the ingenuity of the American public. I really do. I think that we'll tackle this problem. It's not going to occur in the next couple of years, but the next 5 to 7 years, we'll tackle this problem. We'll get this under control. And there is access for everyone today. There is. They can go to the emergency room and get care. But it's the episodic nature of that access which concerns me. Yes, ma'am.
Do you think our healthcare system will be towards feel like
The question is, will our system morph to universal health care? I don't know what that means anymore, universal health care. I really don't. But I do think our system will be more comprehensive in providing care to those who need it. Health care is broke everywhere. Everywhere in this world. If you look at the two biggest single-payer systems in this world, National Health Service in London, by the way, which is the third or fourth largest employer in the world, in the Canadian system. They're broke. They're broke. I was in London last week giving a presentation to National Health Services and hospitals about how private health care can help solve the problems of public health care. I felt as though I was being turned around here. Because I left the plane here as we're moving towards this more public reform. I jumped on across the pond and I talked about how we have to integrate public or private awareness into the public sector. What's going to happen is this pendulum is swinging like this, and it's going to settle in. It's going to settle in. And we will have, ultimately, care for all. What we have today is care for all, but we have selective access. If you have an illness today, you don't have insurance, you go to the emergency room, you'll get the care you need. If you need a renal transplant, a heart transplant, you'll get that care. Now, what will happen is the hospital will send you a bill and you're not going to pay it, and then they're going to fight you, and they're going to say, okay, how much can you pay? So, you can get the care, but it's just that it's indiscriminate whether or not you're going to get the care when you need it, and you're going to delay that care because you're afraid of that bill. But we'll get there. I'm very confident we're going to get there. But I do not want, look, there's some good parts of the UK system, the single-payer system. There's some good parts. And I do think that, we have 30% of our society today a single-payer system. It's called Medicare and Medicaid. Now, it's managed by for-profit entities like Blue Cross, but we have it already. We need to expand it a little bit, make sure that what we provide is the right type of care to the right type of people in the right type of setting. And that's where we're really going wrong. Those three rights, we're really missing.
Hi,
Mr. Samuel, I'm watching you from upstairs.
Hallelujah.
Okay, back in for myself too. Stairs in the, just asking some question. Hand it over to Linda Zola.
Hi, I'm a graduate student, and I was just wondering what kind of opportunities does a person have if they receive a degree in interdisciplinary health services, and how does that make them more marketable in today's society? How does that make them stand out?
Okay, everyone, I guess we're in here from above. I spent again lunch with Dr. Washington's team, and I'm really excited about some of the stuff that the Institute of Health Services really focused on. As an individual, as a graduate student, it's what do you want to do? What do you want to be, and how do you want to make a difference? You can enter into an administrative function. You can enter into an oversight for a clinical function. You can enter into running a hospital. You can run a healthcare system. You can run my company if you have enough experience. So it's more what you want to do. I will tell you, though, that obviously as a graduate with a degree that's multidisciplinary without a specific discipline, it's more about leading and managing entities than it is about providing care. And so I think with a generalist degree, you may be involved with managing interdisciplinary teams, you may be involved with leading teams, you may be involved with leading organizations, but you'll never have that opportunity to really go up and make a difference in somebody's life by touching them. And that's what the caregivers have above all of us. When you're a caregiver, you touch a patient, you make a difference in their life, wow. That's what's really happening, folks. Again, like I said at the beginning, don't forget that. Those who are caregivers, don't forget the importance of that. Every patient you touch, you affect their life. I have employees, I'm off on the rant now, so bear with me. I have employees that work with me for 30, 40 years. They get excited about coming and caring for patients. They're the best employees. The best. The best. I don't know if I answered your question or not from above. I guess I did. Yes, ma'am.
This is Linda Zoller. My question is, what are we going to do about those people that are not so cooperative with being responsible for their health care? In other words, they choose their lifestyle, which has health consequences, and then we as a society are still expected to rescue, to provide care, to overcome great odds, often to try to help these people continue to live, not necessarily a high quality of life.
I mean, that's a great question, and it comes down to personal responsibility. And we know, as you get more than two people in a room, you're going to have disparity. One's going to work harder, one's going to want more, one's going to provide more. So we're going to have a portion of our population as we move towards this patient accountability and patient-centeredness that basically will say, too bad. Well, let me give a good example. One of my associates was at a basketball game, and he stepped outside, and a fellow was smoking. And this is Bob Zimmer, my general counsel. Here's a fellow that's not really outgoing too much. He's a lawyer, but he's kind of a corporate lawyer. And the fellow was smoking. He says, God, I mean, come on, guy. I mean, that's going to eventually, be a demise of you. Plus, you're smoking in front of the kids. Aren't you a little bit worried about it? He goes, no, I'm just hoping for healthcare reform to take care of it. Well, that's not the right answer. That's not the right answer. And there will be, the old 80-20 rule. I think if we provide the resources,